as my ozone therapist really is not my first specialty, because I'm a professor of pharmacology, medical doctor, and I teach clinical pharmacology in the University of Ancona. And about 20 years ago, I started to be interested by this new approach that increased so far in the last years, and is very important for a lot of ailments, and there a lot of interest all over the world. Basically, is a natural therapy, as simply based upon the administration of a gas. So this ozone molecule is quite similar to oxygen. So we breathe oxygen, we live, and we death, because oxygen is a strong oxidant. And ozone is another oxidant. And just coming back in the last century, at the beginning of the century in Germany, they started to do some observation about the potential activity of this gas. And the idea was this gas, that is a very strong oxidant, so at high concentration can kill bacteria, viruses. At low concentration can be very useful to induce in our body an antioxidant response. So this information, this first observation, fit very well with the potential activity in the medical field of this gas, because this gas was being used before for pain and after in aesthetic problem, so for reducing the damage of the aging. So some situation very far by a pharmacological point of view, but for the fact that it was demonstrated that this activity of the ozone is an antioxidant response, we can understand, because usually oxidative stress is at the basis of a lot of problems. So now studies are going on to demonstrate also at clinical level, but now we have a lot of observation all over the world. We need medicine, we need surgery, but sure, ozone in this phase can help us, can help the body to reduce side effects, for example, to reduce the damage of the aging. And if you look forward, sure, we can have back a lot of resources, also by economic point of view, not only by the well-being of the people, because ozone is without any side effects, practically, being simply a gas, and when it is administered at very low concentration. The wide medical area is the elderly. So in the elderly, we know that the population all over the world is going to increase, so the expectancy for life is increasing. This does mean that we have a lot of pathologies related to the elderly. So I'm talking about the most wide, not the most important, because we have also some rare illnesses that we can treat with ozone. But now I would like to focus my opinion in this, because the elderly really will be a very, very big problem. Not because, okay, we are really very happy to live more, but we would live with quality. It's not important to live 90 years, it's important to live in quality. So we know that for this age we have a lot of problem of arthrosis, arthritis, pain, and usually we spend a lot of money in terms of medicine, in terms of surgery, in terms of hospitalization. So in this context, I suppose it is the main topic in which we must look for the future, because really could be very, very important, not only for the medical possibilities, but also for the government that there are increases in this period. So this is the main, but we have a lot of other, so the scope of to study deeply ozone, really, for example, we have some rare illnesses that so far are orphan. So we do not have medicine for this kind of treatment. So why we don't try to do some studies addressed to this? Because, for example, in the sclerosis we know that is there a problem on the motor neuron, and is there an antioxidant enzymes does not work, superoxide dismutases. So, and we demonstrated that small, low ozone doses can induce an increase of genetic expression of this enzyme. I have my own clinic in Italy now, and I have another clinic also in Dubai, where I was invited about 10 years ago. They invited me there to try to treat patients. So what I can say, by a scientific point of view, I am a scientist, so I must to test and to clarify by scientific point of view. On the other way, I have a lot of patients. I treat 1,000 patients that pay each day. They are satisfied without any side effects. Before treat the patient, you must love the patients. So if any medical doctors before come back to the Hippocratic oath, Hippocrates tell us, please love the patients, talk with the patients, and give less damage to the patients. So it's correct to try to help all the people. We can imagine, we can introduce ozone therapy. Could be really very useful for all. I don't want to talk about business, but the people will be healthy, will be happy, with less side effects, and hoping to live more than 90 years, but that, I don't know if I speak too much, probably not.